time to get on this new technology and to discuss a little bit about what we're all going through these days. These are challenging times. And I have to say that I don't like to use the term social distancing.
Whoop. I gotta unmute. Wait. I just muted you, so unmute yourself, Mary. There you go.
Am I okay now?
Start all over again.
Okay, great. Well, good morning, everybody. This is my first experience with Zoom, so I'm a real rookie. So I apologize if I make any big mistakes, but I'm confident that Judy will save me. Right, Judy?
Absolutely.
Absolutely. Okay. So I'm just going to talk a little bit about this challenging time that we're all living. And I think one of the first things I'd like to just share with you, and just to see if you have the same feeling I do, I don't like the term social distancing, because in this time of fear, of concern, of sadness, depression, we need our social contact more than ever. And to be socially isolated or socially distant just hurts me. We need each other more than ever before. And part of what I want to share with you is how we can maintain those social contacts, how we can maintain our emotional, spiritual health in the midst of this challenge with this new virus. I would like to just talk about how we find a balance there, because I think it's important and I think we can do it. So the topic is COVID, flu, and you. And I'll start with flu because every year you guys pull me out of my box, dust me off, and we have a little conversation about why the flu shot is so important and how we can prevent catching the flu and spreading the flu. So flu shots are now available. You've seen them when you go into the pharmacies, grocery stores, in their pharmacy, they all have them. And I encourage you to get it early this year. And by early, I mean in the next few weeks. September, October at the latest, get that flu shot. And most of us on this call, I think, are 65 and older. And so please ask for the senior high dose, okay? That's really important for us that are over 65. Because it's 4 times as strong as the normal flu shot. And we need that little extra boost because our immune system isn't quite as robust as it was years and years ago. And the other thing I want to say is the good news this year about the senior high dose is that it is a quadrivalent, meaning it has 4 components, 4 flu strains incorporated in it. So there's 2 A strains and 2 B strains. And we know that the A strains circulate in the fall and the B strains circulate in the spring. So with this vaccine, we've got it covered. We're going to be pretty well covered. Hopefully it's a good match and it's going to do the trick this year. So the 4 times the strength, does that hurt more? Does it have a bigger impact on our bodies? You know, we've been using the senior high dose for a number of years, and anecdotally, I don't get any complaints about a more sore arm or any kind of systemic kind of feeling achy or anything like that. So I just really want to say, get that senior high dose. And why do we need it? Because as we age, which aging is not for the faint of heart, as we all know, things just don't work quite as well as they did years ago. Our muscles aren't as strong, our eyesight's a little weaker, our hearing might be a little diminished, our GI function is sluggish, you know, the list goes on and on. So for our immune system, it doesn't mount the same kind of response as it did 20 or 30 years ago. So the high dose helps our bodies to produce more antibodies, so we're better protected. So flu, how is it spread? Water droplets. You know that story. We've gone over this time and time again. But the reason that we're really strongly encouraging flu vaccines this year early rather than later is that the symptoms of the flu and symptoms of COVID really match up. Fever, body ache, cough, headache, the general malaise that we feel with the flu, that mirrors the COVID symptoms. So we want to take flu off the table. Okay, we want to say, you go to your doctor and you say, just I've been having this achiness, my fever's up a little bit, I just don't feel good. Maybe they can say, all right, we're going to swab you for the flu, but we're also going to swab you for COVID. So at least we can take flu off the table if we have a good response and good immunity to the flu, and so we can address the issues appropriately. So where do you get your flu shot? Your doctor's office, pharmacy, health department. And so people say, is it really safe to go out? It's a scary time. But I'm going to tell you that my experience has been that doctors' offices are taking very serious precautions. They're taking your temperature. They're insisting on a mask. They're spacing the chairs in the waiting room so that we have that physical distance. And pharmacies are doing likewise. So we really want you to take that chance of going out and getting that flu shot. I think it's worth the risk, especially if you keep in mind all the infection control strategies that we've been harping on for the last 6 months. And what are they? Wear a mask, wash your hands, physical distancing. I want to encourage you to have confidence in your ability to keep yourself safe. I heard on TV not too long ago, one of the talking heads who was asked, what are we going to do? We don't have a national plan, or we don't have people, directing us. And this person said very clearly, you have responsibility for yourself and responsibility for the people that you love. So that being said, I want everybody to know that they can keep themselves safe. And we're going to just review a few things to do that. It's fearful. I mean, I'm filled with the same fears that you all are filled with. When I hear on TV that they say, by the end of December, 130,000 more Americans will die of COVID. And I say to myself, am I one of those? Is somebody I know one of those? And that kind of stirs up a whole lot of anxiety. But we know how this virus is spread. We know a lot about it now. It's been around since February, March, and here we are in August. So we're 6 months into it. We're 6 months smarter. We have a better way of addressing it in terms of there's things like plasma, if you get it, okay, that can address it. There's steroids that can address it. There's supplemental oxygen that can address those symptoms that hopefully will keep you from really being seriously ill with this disease. We're in a much better place than we were. We all remember everybody was clamoring for ventilators, and then it was like, well, if you get on a ventilator, you never get off the ventilator. And I think we didn't know about the steroids. We didn't know about plasma. We didn't know about therapeutics. And every place that's doing research on that are coming closer and closer to a really good remedy for this. So that being said, I want you to know that, God forbid you get it, there's a lot better ways of treating. But you don't get it. That's the big point. And I want you to feel very proud of the fact that New York has come a very long way, and we have a very low rate of infection. It's not as prevalent in our communities today, but it's not gone by any means. And what's going to happen in a few weeks? School's going to start. College kids are going to return to Albany. COVID's still out there, and it's still a risk, and we're still an at-risk population. But we're better off than a lot of states. You know, and that brings up another little point about travel. You know, everybody has family and friends that live in different states or different parts of the state and the city, and those, you know, those places that have been hotbeds for COVID. And you should be aware of that, that when somebody comes from Florida, Texas, California, they really should quarantine for 14 days. That's important. It's very important because it can take 14 days for that virus to manifest itself. So if somebody says, somebody has said to me, I went to South Carolina, but I took the test. I'm negative. I can come to your house. And I said, you can't come to my house because a negative test is a moment in time. You came back from South Carolina. You went to Rite Aid. You had a test. It was negative. But you've only been back from South Carolina for a few days. And I don't know for a fact that that virus isn't incubating in you, or that you're not an asymptomatic shedder or an asymptomatic spreader of the virus. So friends and family that come to visit, they need to be quarantined for 14 days before they should be up close and personal, right? That's important. So, does anybody have any questions up to now? I just don't want to keep going if there's anything. I don't see anything in the chat box.
Oh, I just put something up there, Mary.
Oh, I see it. Okay. And the question is, if our grandchildren go back to school in an actual building, do we need to avoid them? Very good question. Here's how I would respond to that. Once schools start, in any school year, kids begin to spread illness among themselves. Little kids more than older kids. And I suspect that once schools start, there's going to be a little bit of a bump in the road, and we're going to see more cases. And so the answer is basically yes. But how? You know, you don't want to avoid them altogether. We need that. They need you, you need them. How about meeting on the porch, meeting in the backyard, meeting on the patio, going to the park? Wearing a mask is very important. Washing your hands, keeping that separation. I mean, we have to prevent that spread. So we don't want to do hugs and kisses at this point. But that's a very good question. Even college students, if they're going away to college and they come home, really and truly, take that time to keep that distance, because many times children, and we've said this in the past with the flu, they don't always show the symptoms as seriously as older people do. So they might not be febrile. They might not be coughing and sneezing. They just might have minor symptoms, but they still have the virus. They still shed it. They still can transmit it. Good question. Anything else that before I go on a little bit farther? Okay.
Folks can signal in the chat box or just raise your hand. There's an icon for raising your hand, and I will unmute you.
Great. Thanks, Judy. So COVID is spread like the flu. It's more airborne, water droplet. That's why we wear the mask. That's why if you don't have a mask on, you're going to sneeze into your elbow. That being said, it's spread like the cold, it's spread like the flu, but it's much more lethal. Okay? So that being said, the lethalness comes because it's novel, it's brand new. None of us have any defenses against this. we can harken back to 2009 when H1N1 came around, and it really was devastating to younger people, children, preteens, teenagers, young adults. But people our age, a little bit older, we had seen H1N1 in the past. We weren't as affected by it because we had an experience of it. We have T cells that are cells in our body that can remember what we have experienced, what we have been infected with, and we have the antibodies to address that disease. But in this case, COVID-19, this coronavirus is novel, brand new to the human race. And therefore, we're all sitting ducks. We're all vulnerable, okay? So it's basically breathe in, all right? So we're in a room, somebody's sick with it, you don't have a mask on, they don't have a mask on, very easy transmission, okay? And we say within 6 feet for 10 minutes or longer is kind of the ideal setting for the transmission. Does it live outside the body on surfaces? And the answer to that is yes. People have been able to find it on doorknobs, to find it on tabletops, to find it on a pen, to find it in our environment, maybe on mail, I'm not sure. I've heard in the beginning of this pandemic, people were cleaning their groceries before they brought them into the house. Perhaps that's true too. But what I want to say about that is, we're not licking the door handle. we're not getting our nose and mouth up close to that inanimate object. Okay, it's our hands. Okay, the hand touches the door. The hand uses the pen. The hand, shakes hands with someone. And then without good hand washing, hand hygiene, hand sanitizer, and we touch our nose and our mouth, that's the transmission here. Okay, so the confidence I want to give you is if you keep your hands washed, okay, frequent hand washing, good hand washing, using soap, taking the 20 minutes, that's excellent. Have a bottle of sanitizer in your purse, in your car, handy, just inside your door, hand sanitize. Here's the other thing that I like to share with people. I go to the grocery store, I'm wearing my mask. I come out of the grocery store, I get in the car. Before I touch that mask, before I go near my face, hand sanitize, take your mask off, okay? Do it in that sequence because we don't want those germs on our hands to get anywhere near our eyes, nose, and mouth. That makes sense, right? Yeah. With hand hygiene, so if you bring something into your house, okay, somebody delivers a package, puts it outside your door, the mail comes, people deliver food to you. How do you deal with that kind of stuff? If you can just put it aside for 24 hours. We don't think that virus is transmissible outside the body, on a fomite, on an inanimate object after 24 hours. So some people just put their mail aside, put their packages aside. I don't know what I did 24 hours before I opened the package, but they put those aside, or Clorox wipes, Lysol wipes, you can wipe things down. We have the power to prevent this infection. We have a lot, we have to take our power back. We have to take ownership of how we're going to protect ourselves. You can do it. I want to give you the confidence and the, what do I want to say? I want you to be out there fighting that virus, but out there a little bit more because I'm concerned about our mental health. This is a new way for us. We're very social beings. We relish being with one another. That sharing, there's no replacement for it. A phone call's nice, and this is a wonderful technology too, but I can tell you that I'm really missing being in a room with you guys, looking at your faces and hearing your comments and taking your questions in a very spontaneous way. And so we're missing that. And so we have to take back our power and to take back our ability to connect, because that's so, so important. So we talked a little bit about people delivering packages to your door. You know, some of us have have maybe a physical therapist coming in, maybe not. I'm not sure how open they are at this point, but we might have our groceries delivered. We might have a housekeeper. We might need the plumber to come in. You know, whoever it might be that comes to our house, wear a mask. It's your house, but you wear a mask and insist that the person coming into your house, they also wear a mask. Keep that physical distance if you can. If you're getting PT or nursing, that's going to be up close. But remember, within 6 feet, 10 minutes is kind of the ideal scenario for transmission. So if you can limit it to less than 10 minutes, keep that 6 foot distance, your risk goes way down, right? But family and friends, again, it's very hard, and there's a lot of peer pressure about mask wearing. We might get invited to a party, or we might see friends, and if they're not wearing their mask, sometimes we feel kind of sheepish about, gee, if I put my mask on, that sends a signal that I think they're not healthy, or they're not keeping to the rules. I have to admit, here's, you know, my confession. I was invited to this called an I Do barbecue, and it was my family, and went with my mask and got out of my car and walked around to the backyard where everything was set up, and I thought, this is going to be perfect. They have tents, it's outdoors. I was wearing my mask. Nobody else had a mask on. I felt like I was the skunk at the picnic. It's like, oh my gosh, here I am. So I pulled my mask down a little bit and smiled at people, and, you know, had a drink, greeted everybody, and then left. I just I couldn't stay because of what I know, but I also couldn't wear my mask because of peer pressure. So, I mean, it's hard. Since that time, that happened back in May, I've gotten a little more brave. I've gotten a little more confident to say, I'm doing this because it's the right thing, and I want to model this behavior for other people. Because we all know that our behavior is the last thing to change. We have a lot of knowledge. We know what we want to do, but to actually put it into motion, to actually change our behavior, is hard. It's very hard. And it might not be the first thing we do, and then we beat ourselves up. But that being said, just give yourself permission, keep yourself healthy.
I think that's a really good point, Mary, because there's been a lot of, it's been politicized. The whole illness situation has been politicized. So it's like, if you're wearing a mask, you believe one way. If you're not wearing a mask, you believe another way. And there's a lot of shaming and judging going on. And, you know, I would like to hope that we're all of an age where we've been disliked by some people all our life, and it really doesn't matter to us. What's most important is that we follow our own knowledge base and our own internal compass about how to act, and not be, you know, influenced by other people's decisions. We have a right to protect ourselves. We have a right to protect other people. So, you know, following those practices, I think, is really important. And we don't need permission. That's the most important thing. We don't need permission. So there's a couple of things in the chat box.
Yeah, I'm seeing those here.
So if you could address those, that would be great.
It says, here's the question. It doesn't have to be antiseptic soap, correct? It's just the mechanics of washing enough, and that's true. Soap is good because it loosens the dirt on your hands. It loosens the grime, and it helps to rinse it off. But you're right about the friction is an important way to remove the germs from your hands. And the other question here is talk a little bit about how to strengthen your immune system generally. And we've talked about this a lot in the past, and I think that it's always good to reinforce the things that keep us well. And it comes down to the very simple basics that we all know in terms of getting enough sleep, good food, adequate exercise, fluids. You know, don't get to be a quart low. I mean, if you're becoming thirsty, already low. So those are really important things. And I know that our immune system thrives when we're happy. There's been studies about people who are they are in this situation where there's a lot of laughter. And for some, I don't even remember, but this was a study I read about a long time ago. It showed that there was a boost in our immune system because there was joy, there was laughter, there was camaraderie. So I think all those things. And when we have a good attitude, I mean, our attitude of gratitude, our attitude of positivity, I think that that makes a big difference in how we fight off infection. Does anybody have any comments about that? Anybody know that, share an experience about when we're really low, we seem to be more vulnerable to getting sick, getting cold, getting viruses. Anybody have that experience?
You can raise your hand and I will unmute you if you would like to share. I guess we have a bunch of happy people, Mary.
Yes, we do. I guess we do. I just, you know, my experience is around, you know, big holidays when everybody has a little bit more stress. Everybody is working really hard and not getting enough sleep and eating only junk food. That's when we tend to get sick. That's when we tend to be not at our best. We're not on our game. So there's another comment in the chat box about glasses, and do you see them as a point of vulnerability? Absolutely clean your eyeglasses. Absolutely, because we touch them with our hands, and then our hands can be contaminated. The virus isn't something that can like jump, okay? It's not something like if my glasses are contaminated, that virus needs to actually touch my mucous membrane in my eye, okay? And that's the other point about our skin. Intact skin is a natural barrier to disease, okay? Intact skin, right? Skin that's broken down, that leaves us a little more vulnerable. So the idea of cleaning your glasses, good idea. Your eyes also are a point of entry for this virus. Now, people like here at the health department, when we are seeing patients, we're wearing our masks, but we're also wearing a face shield or goggles. And that's because we said that the virus is in the air, okay, water droplets. It's aerosolized sometimes. People in the dental clinic, if anybody's been to the dentist recently, they've always been good infection control practitioners. They've always been very careful, but I think there's a little heightened awareness. And so that's a good thing too. Good questions about those things. So just to recap, 6 foot distance, wearing a mask, keeping your hands clean, keeping your hands away from your face, away from your eyes, your nose, and your mouth. Staying socially connected, I think, is a very important thing. I think it helps us in so many ways. I think getting your flu shot early is a great thing. And I also think that we need to have confidence that the healthcare system is going to be a safe place for us to access, okay? Because we're going to need to do our routine screenings. We're going to need to visit for a blood pressure check, and we need not be afraid if we take back our power to keep us healthy. The risk is out there. I'm acknowledging that, but I don't want people to become prisoners in their home, to become so lonely or so down that impacts the quality of their life. I've heard some very sad stories about, you know, the nursing homes very early on. They had to quarantine, they had to isolate all the patients that were in nursing homes to the extent that they closed the doors. They were in their rooms with doors closed. Their meals were brought in. They ate alone. Their families couldn't visit. You know, it was telephones and this kind of technology. And I got it from very good sources that so many of those patients began to lose weight, had no interest in anything that they had done in the past, their hobbies. And so it really spoke to me about, you know, how much we need people. And once they started just to open the doors of their rooms and they could see people passing in the hallway, things started to turn around and things started to change. So, you know, just taking that example and taking the fact that so many of us that were living alone, or, you know, we don't see a lot of people, it takes its toll. But we're going to get through this. Is there an end? I don't have a crystal ball, but I'm thinking that things might get worse before they get better in terms of like bringing people back together in schools, okay? In colleges and universities, more people are back to work. We're going to be inside more than outside. And it's going to be the naturally occurring virus season that we have in the spring and the fall. I want to just point out the good things and not all the bad things. The good things are we got a quadrivalent vaccine, and flu might not be as prevalent this year because we're doing all these infection control things. So we're going to get the flu shot. We're also keeping some physical distance, and we're very diligent about hand washing, and we have the things we need like masks to keep us well. So.
Okay, I think maybe just put some things in the chat box. One was a question about beauty parlors and nail salons. And just generally, I think perhaps, I don't know, Mary, if you would agree, this is a good time to kind of open it up to a little free flow discussion, allowing people to unmute themselves. I really appreciate what you have to say about social connection, about positive attitude, actually boosting the immune system. That's not woo-woo, it's science. They can actually measure it. So when you have a happy heart, your body follows along with you. So that attitude of gratitude is really, really, really important. So if everybody, if you want to address the question of beauty parlors and nail salons, and let everybody unmute, feel free to unmute yourself so we can have a little conversation.
Yeah, beauty parlors and nail salons. You know, the beauty parlors now, in my experience, they're checking temperatures. They are wearing masks. They're having their clients wear masks. So I think that given those precautions, it might be safe. And I say might because I can't be 100%, but you know, you can go for the essentials, and the less time you spend, the less risk you have. So you can go and you can say, just give me a trim. You know, I'll do my color and I'll do my perm another time. You know, you can defer those things if you're concerned. But I just know that a lot of the salon owners, they're testing routinely. Remember, a test is just a moment in time. Don't take that as they're free and clear, okay? It's a moment in time. Nail salons, I haven't been back, but I hear that there's plexiglass. They wear masks, you wear a mask, they wear gloves, your hands are through the plexiglass and this little cutout. That can be an hour exposure, but the plexiglass and the mask and the gloves, they all help.
Mary?
All my friends that usually give me a heart, other questions and comments.
Yeah, we have somebody who's speaking now.
I've been
Okay,
raising Mary, I don't know who if I'm talking. Can you hear me?
Yes, I can hear
Yes.
I'm going back because I raised my hand a long time ago for the same. Back to the flu. And you mean, in other words, at this time now you can take a flu shot and that will be effective
correct.
this early?
Yes, because we're under the assumption, and scientists tell us that the flu shot will last the whole year. Personally, here it is mid-August. I'd wait till September. That's just me. New York State Department of Health came out with a recommendation September and October for flu shots. I know it is available, and if you're out and this is an opportunity to get it and you might not be able to get out there again for a month or two, I would take the opportunity. Don't lose an opportunity to get it if you know that you won't be able to avail yourself of it until.
Thank you. Thank you. I'm going nowhere. I stay home.
This whole time is an introvert's dream, right, Lenore?
Yes.
Definitely. I have enough in my, I have the TV, the computer, I have books, I have puzzles, I have a telephone. Fine. That's it. If I want to go down, I walk the hall, period. That's it. Or sometimes I come see my children on the deck where I am right now. That's it. So far, my body is getting old. The head's still good, but the body is getting old. That's for you, Judy. I'm not exercising. I'm exhausted. I am. That's for you.
Come and join my yoga class.
I know about it. I keep saying I will one day. One day.
Well, today is one day. So.
I know. You're right. You're right. Thank you.
We missed your jokes, Lenore.
Thank you. I haven't got any new ones. That's what I enjoy telling. Thank you.
It's Michelle here, Mary. Since we're on the subject of flu, I want to follow up Lenore's question, particularly about the high dose flu vaccine. Is that available at all of those locations you mentioned? Your primary care physician office, the pharmacy, the health department, they all have access to that?
Correct.
And I'm just wondering if you've heard anything about the option, if anyone's talking about this, of medical professionals visiting someone in their home to administer a flu shot.
I haven't heard that. I know that there are some practitioners that actually do home visits and they would administer in the home. But that's a rarity.
Yeah.
Given the current,
put everything away. Well, most of it's in the freezer.
Site.
Most of the stuff went to the freezer.
Excuse me, somebody's speaking.
I put away.
Please silence your mic if you're not asking the question. Thank you.
Thanks. Yeah, there might be opportunities to have like some clinics close to where a lot of the seniors are living. We've done that in the past when there's been a need. There hasn't been that discussion of late, but yeah, unfortunately, I don't know of like visiting nurses doing it.
Okay.
Yeah, sorry.
No, I'm just wondering, because I'm wondering if they are starting to consider that given the COVID climate right now.
Again, get the vacuum.
Sorry. I had your voice before.
I'm thinking too that, correct me if I'm wrong, Mary, because you certainly know so much more about this than I do, but there's also this whole question of time exposure, the time of exposure, the length of time of exposure, and the intensity of the exposure. So in other words, if you're out of doors or going into a pharmacy and you're spending maybe 10 or 15 minutes getting an injection, that's a whole lot different than riding in a closed car with somebody, even if you're both wearing masks for a half an hour. Is that correct?
Absolutely correct. Absolutely correct. It's 10 minutes, 6 feet distance, and it's also, if you have a case, a positive case, it's how long have they had it? You know, how much virus are they shedding? There's a lot that goes into it, but you're absolutely right, Judy, that a 10-minute, you know, exposure in a pharmacy or in a doctor's office is a much lower risk than half an hour in a closed car. Air conditioning, they say, you know, can facilitate the spread. So if you're in a, you know, in the car where the air is just circulating because you have the air conditioner on and somebody is coughing, sneezing, and a positive case, then you got the perfect storm there.
Does every one of these places have the senior high dose?
Yes.
I think most of them do, but you know, I would say call ahead. If you were going to go to Walgreens or CVS, I would give them a call and say, I'd like to come in for my flu shot. Do you have the senior high dose? And I would really insist on it. And if more people call looking for it, I'm sure that they will have it. But I know that the pharmacies have gotten their stock already. We don't have ours yet, but you know, the retail places seem to get it quicker than we do.
I know each year, I don't know about this year, Rite Aid comes to our building. They come the beginning of October, usually. I just wondered, well, I would question if they have the senior heights. It's too late. All right. But they usually come the first week in October.
That's excellent.
The JCC is having a clinic. I got a call the beginning of October. CVS is coming to, and they're having a clinic for the seniors.
Where is that?
At the JCC, I got a call from they're doing it in the parking lot. But if yeah, and I told her I already had an appointment with my doctor the first week in October, but otherwise, yeah, otherwise, yeah, if you check with the JCC, they're having a clinic.
That's great.
So,
And
yeah.
the JCC should alert them that you're really going to have the demand for the senior high dose.
Okay. Well, I got a call from Eileen early, and also if you go on the webpage, or if you get an email from the JCC, there's a link that says that there's a clinic for the flu shot.
Good.
Okay.
And Michelle, I'm sure there's a way that we can include that announcement in our North News or Constant Contact.
Yeah, I think I do know, I'm aware of it. They have very limited spots. I do want to say that. And I also did want to confirm that they had the senior high dose. Because again, I think that's just really, people need to know what they're getting. So we want to be absolutely sure that this is the vaccine that's going to be most effective in keeping everybody well this season.
Yeah. And the point, to your point, you need to let them know that you're coming, because this is not just a walk-in kind of situation. Just like the COVID testing sites, you must call ahead to let them know that you're coming.
Yes.
So yeah, please, please,
there are
please
specific
do that.
appointment times, right?
Yeah, don't just show up and expect to get a flu shot.
Right.
So, anything else? Any other questions, comments, queries?
I can keep going. I don't want to take up airspace. But
no, well, you know what?
Questions.
Keep talking, Michelle, because we have the time. And what my experience is, if somebody has a question, generally that question is also owned by some other people too. So go for it.
So a mask question. And I know bottom line is wearing a mask is better than wearing no mask. However, starting to see articles about types of masks being more effective than others. Also, in my own experience, when I've had some visits with people recently and I'm wearing a mask, I'm talking loudly very often because the person I'm speaking with is hearing impaired, and that mask is getting saturated. And I know that means it's also less effective in keeping us both safe. So wonder if you can just speak to type of mask and also like that change of mask, when that's necessary to do, when things like that happen.
Yeah, that's a good question. You know, there's all kinds of masks out there, like you say. The N95 mask is the most effective mask. It's 95% of particles are not able to be transmitted. Both ways. Okay, it's very tight fitting, goes around your head. It's very hard to wear that for any length of time, especially if you're walking or talking a lot. It's really kind of constricting some airflow, and so that's a tough one. And really, that's not the kind of mask that we need in the community. They need that certainly in emergency departments and in the hospital and when they're caring for COVID positive patients. You know, a surgical mask is good. The cloth masks are good. They're talking about 3 plies are ideal. But if your mask is wet, it's less effective because we used to say, you know, the capillary action, it can kind of draw in things if it's wet. So we would want to change that. And I didn't mention in my talk too that, you know, viruses spread more easily when they're singing, shouting, loud talking, and you alluded to that, Michelle, when you're talking loud to someone who's hard of hearing, that there's a lot more water particles that are being expelled just by the strength of your voice. So it would be a better idea to change that mask, wash that mask, because it's less effective. You're absolutely right.
Mm-hmm. Great, thanks.
You know, people wear bandanas, and there are like areas with the surgical mask on the side where air comes in and out. But, you know, it's, again, with, you know, if we're 6 feet apart, by the time, you know, the water droplets the aerosolized stay in the air a lot longer, but the water droplets that are coming from singing and shouting and talking loud, those are bigger particles, and they drop to the ground. They you know, they're not in your airspace by the time they go 6 feet. So, so that's a good, you know, that's a little reassuring in my book.
Definitely.
Yeah, good question. Does everybody have masks? They have, you know, you have washable ones, disposable ones. What are you using?
I was one of the mask super seamstresses in the beginning of the season.
Good.
I don't know how many of those puppies I cranked out, but it was certainly a labor of love, Mary.
I'm sure.
To make sure that all of our people stayed safe. And I'm wondering, might be time to revisit that, Michelle, and start making some more, because they might be getting
Perhaps it's time for
a revisit, as much as I would like to stop. I think maybe it's time, but yeah, I throw mine right in the washing machine, and we keep a supply of clean ones hanging on a little, you know, knob by the washer, and just off you go. Another question, I don't know if anybody else does this, but when we have the masks, and they're cloth masks, we leave them on the dashboard of the car. And in the summertime, I get the feeling that they're being baked and sterilized by the sun. Is that faulty thinking?
No, that's absolutely right. You can hang them on your rear view mirror, the sun comes in. I mean, there's something to be said about that kind of sanitation, and that does work, yeah. And masks are only effective if you wear them properly. It can't be below your nose. They can't be under your chin. You know, they can't be half in, half out. It's all or nothing when it comes to masks. You can't just cover your mouth. You have to get the nose and the mouth.
And in the heat of the car, they're drying out too. So if there's any moisture in there that's causing capillary action, that's going away. So that's our little individual automobile sterilizing technique.
Good idea.
I love it.
Judy, this is one of yours.
Oh, that was one that Jane made. She did some beautiful tie-dyed ones.
That's it.
Mary?
Yeah.
I was wondering, I saw some filters and packages at Boscov's, but I don't have any masks that have a pocket in it. Does anybody Does anybody have a cloth mask with a pocket in that you could put a filter in? It says
I don't
that
have
they're,
that.
it says on the package that they're made to put in a pocket in your mask. And I've never seen anybody selling any masks with pockets.
I've seen them online, and early in this pandemic, you couldn't get coffee filters. I don't know if anybody tried to get coffee filters for their coffee
I did read
Had that problem.
coffee filters, and they were shoving those in their masks as a filter. Yeah, I think I've seen them online where they have a place to filter. You know, I think there's a lot of entrepreneurial things going on, and people are making some interesting money on this.
Yeah.
But I think, you know, your basic mask is going to do the trick. It's you're just preventing your water droplets from getting to somebody else and back at you. You know, you're protecting yourself as well.
So are there any other, we're right on the dot of 11 o'clock. We have more time if anybody needs to ask a question or make a comment. I really want to thank you, Mary, for making yourself available again to the NORC.
Thank you.
We love you and we depend on you for the most up-to-date information. And I feel very encouraged by what you had to share, in that we do have the power to help ourselves be healthier. All we have to do is pay attention to some very, very basic rules. And, you know that the NORC is here to help you. You know, the nursing staff, the case management staff, we are here. We're just a phone call away, and we are just, operators are standing by. So we love to talk to our people about anything and everything. Isn't that right, Michelle?
Absolutely. Yep. Echo all of that.
That's what makes this community so strong.
Right.
So,
And to keep up those, like, you know, what Judy and Mary both alluded to about keeping these connections alive with one another. You know, our utmost concern is the health and wellness of everybody in this community. But we also recognize that the NORC program provides a lot of ways to connect with one another, and we're having to do this differently. So opportunities like this, yes, it's over Zoom, but there's still, at least we can still share and talk and see one another. And just hope you take advantage of that, because I think we'll be doing this for a long time.
I wanted to just say thank you, Mary. It's always so informative and interesting, your lectures. And Judy and Michelle, thank you for the Zoom.
Thank you.
You. Always
Our
nice to
pleasure.
meet you.
so everybody, stay healthy, stay safe, stay hopeful. And we'll see you all soon at another Zoom program. Love
Thank
to
you.
you all.
Bye.
Thanks, everybody.
Bye.
Thanks, Mary.
Bye. See you later.
Everyone have a nice one in my name.
Mary, if you want to give me a call when we're off, then we can just chat a little bit.
Okay, sure.
Okay.
So you see his here.
Okay, you could shut it.